Kiran sir, please confirm is the screen visible?
Yeah, it's there. Just put
Yeah,
it in slideshow mode. Yeah, done.
Yeah, is it?
Yeah.
Kiran sir, can we start the recording?
Yes.
Good afternoon, everyone. iTech India welcomes all the participants for today's special National Distance Learning Seminar Series. Today's topic is index testing at ART centers, and the speaker is Dr. Sudhir Chawla. Dr. Sudhir Chawla is the public health specialist with CDC India. We welcome you, sir, for today's session and request you to start the session.
Thank you, Sweta, and good afternoon, everyone. As Sweta has mentioned, today's topic of discussion is index testing at ART center. Before we discuss index testing at ART center, we will discuss in brief about the index testing, what it is like. So then we will come to the ART center, how we can do index testing at ART center. So you can ask your questions in chat box, and I will try to respond on that during the session. Next slide, please. So as I said, the index testing, there are a few steps in conducting index testing wherever it will be, like at ICTC or ART center or anywhere. So we will discuss the concept of index testing, then the 10 steps of index testing, how it should be done. There are 4 strategies by which client can agree to bring their partners for HIV testing. I'm just refraining to use term notification. When we say notification, people think it differently, but it's not like actual notification sort of thing. It's basically 4 different strategies how our index case can bring their partners for HIV testing. We will discuss about those 4 strategies. Then we will discuss in brief about the adverse events. What are the adverse events? What can be termed as adverse event, and how to investigate and how to address these adverse events. There are 8 principles of index testing and some minimum standards which we will discuss, and then of course about the linkages with the treatment or community engagement. And I will briefly touch about the blending with social network strategy also, and then we will discuss about the take-home messages. Next slide, please. So we will first discuss about the concept. Next slide, please. There is a gap in terms of achievement of all the 395, and still there are significant proportion of people, those who do not know their status. And as we know, to achieve our ultimate goal of elimination of HIV as public health threat by 2030, all those who are HIV status at a given point of time, they should know their status. It can be a person from key population, or a woman, or their biological children, or simply a person from general population. So everyone need to know their HIV status. And those who are knowing their status need to be linked with the treatment services, and their ERT should be started at the earliest, and they should remain in care with 100% adherence, so that their viral load remains suppressed or undetectable. So where are we missing? So why we are not able to reach people? There are people, those who are regularly being missed from offering HIV testing. It can be like a person from hard to reach area, or from unreached areas, or from the difficult terrains. I think slides are not visible now. So we need to understand who all are the people, those who were like missed for offering index testing, and accordingly we can take some steps. Next slide, please. So like I said, there is a gap in terms of first 95 achievement, and sometimes people say like first 95 is the work of ICTC, second and third 95 is the work of ART center. It's not our work. Let them do their work. They are not doing it properly. It's not like that actually. If you know, all the 395 is actually being calculated from the ART MPR only, and everything is interrelated. It's not the work of one person and not for other. It's not like that. it's equal responsibility of everyone who is working in a national AIDS control program, and in fact I will say like everyone's responsibility to make people aware of HIV and to motivate them to get themselves tested at the earliest if they have any sort of exposure to HIV, or if they perceive themselves at risk of getting HIV. So there is a gap of 18% at national level. This is from the latest Sanklak report. And whatever approaches currently we have under program to diagnose people, I think are not sufficient, and we need to have some different kind of approaches to plug this gap. So idea is to test more people so that more and more people should know their status. And with the global evidence, index testing is an effective strategy to identify new cases of HIV infection. So that is what is like considered under program for improving our case yield. Next, please. So I will briefly touch base about what is index testing. So it's basically offering HIV testing to the partners or the biological children of the index case. Index case is our HIV positive person presented at the facility. So whosoever is the is at risk of getting HIV, it may be the partner, it may be the spouse or the sexual partner or the injecting partners. When I say injecting partners, means the needle sharing partner actually with whom the index case is sharing needle syringes or the injecting equipments. And the biological children's can also be the other potential index contacts. So we need to inquire about that also if it is like the less than 19-year old biological children are there. So if our index case is a woman who is HIV positive woman, then we need to inquire about the less than 19-year children of that woman. If index case is a male and report that the child's mother is HIV positive or diseased or her status is unknown, again we need to inquire about the less than 19-year of children of that male. And if index case is a child of less than 19 years, then definitely we should inquire about the biological siblings and the biological mother and father of the index case. Next, please. So as we discussed, who can be the index case? It's HIV positive person presenting at the ICTC or the ART center, wherever the index testing is being offered. So basically, anyone who is HIV positive, it can be adult, adolescent, children, from general population, bridge population, key population, anyone who is HIV positive presented at the site at the center. When we say contacts, it's like for the sexual contacts, it can be anyone who with whom the index case had sex with, even if it was a single encounter or with the use of condom or not. We should inquire about everyone. Maybe we can start with the latest to go back in time for at least 1 year. And for needle sharing context also, we should start inquiring about the latest and then go back in time for last 1 year with whomsoever the index case has shared needle or the injecting equipment. It can be just one time, or even if they say like we are usually using clean needles, we are using clean needles, or after taking my injection, I cleaned the needle and then shared with the other person. It's fine. So we need to inquire about that. So there needle sharing, there may be two type of contacts. One is with whom they have actually shared the needles. Other thing may be like the social network, then people sitting in one place and taking their injecting drugs, but they are not actually sharing their needles or the equipments. So that may be their social contacts. But if someone is sharing their needles or syringes with the other person, that will be definitely the needle sharing contact. Children of less than 19 years, I think we have discussed in the previous slide. Go to the next slide, please. So as I said, index testing is an effective approach to saturate HIV case findings, and we have evidence from the from other countries and within country from the PEPFAR geographies. We have evidence of like how index testing is effective in reaching out to the hidden population and to the untested population. We have positive results to the tune of like 20-30% positivity among partners of HIV positive index case. Next, please. So ultimate goal is to test all those who are like exposed with the minimum standards and the principles we followed, so that we can plug the gap in first 95. And for that, before offering index testing, we need to ensure that those who all are like involved in index testing, they need to be trained on index testing services, and all the facilities where PLHIVs are visiting, people under a national risk control program may need to be like trained on offering index testing, and then subsequently we can implement index testing from those sites. At the same time, we should engage community members also, which will be like supportive for improving our linkages to treatment and prevention services. And we need to document whatever we are doing under index testing service. That documentation need to be there. Next, please. So whenever we offer index testing, whenever we counsel people for HIV testing, and if they after the HIV testing, if someone is HIV positive, we offer them index testing. And after offering, if they agreed for sharing their partner details, they shared, say for example, they shared 3 partner details, and with all the precautions and the stepwise approach, we reach out to these partners and found 2 people out of these 3 are positive. So we need to enroll these 2 new positive as again index case, and again we have to offer index testing to them. This is the commonest mistake which people in field are doing. Like, I know like this person is a partner of my index case, there is no need to inquire about this person's partner, because this is actually a partner of the index case. It may not be like that. We need to inquire about their partner. It can be more than one partner, so we need to inquire about their partner as well. So always remember, whenever there is a HIV positive case, we need to register this client as an index client and try to inquire about their contacts. So and at the same time, all HIV positive need to be linked to the HIV treatment services, and those who are HIV negative need to be linked to the appropriate prevention services, whatever is available in our area. If it is like injecting drugs user, we need to link them with the harm reduction services, or in case of others, we need to link them with the prevention services like condoms or the PrEP if it is available in your area. Next, please. So why it is important to offer index testing? Like someone may ask, what is my benefit if I am like tested, I am positive, and if I bring my partner, what is my benefit in that, and what is the benefit to my partner or my children's? So I think it will be good to discuss this thing upfront, because people may be like willing to know more about the benefit of index testing, participation in index testing services. Like you can say like, okay, for the next client, you can say like, okay, this you may feel discomfort, or you may feel some have some apprehensions of like sharing your status with your partner, and tomorrow if your partner came to know about your status, what will happen? I am there to help you if you want to like share. Otherwise, I am not going to share your status directly with your partner. If you wish and you give consent, I will accompany you to share your status, or otherwise this will be beneficial to them, because uh, they do not, as of now, they do not know their status, and since they are not knowing their status, they are at risk of like their health conditions may get worsen. So if they know their status, they will be getting all the healthcare services at the earliest, and they will be linked to the treatment services, and they can live a quality life. So and accordingly, you will also be like able to spend your quality life with your partners and the children's. That way we can discuss with them, and overall it will be beneficial for the community, because the suppression viral load will be suppressed in your blood, and you will be on ART, and your partner will also be tested and started on ART. So ultimately transmission will suppress. That will be the larger interest of the community and the country. So that way we can explain to them how it is like beneficiary for everyone. Like, next slide, please. So for children, you can use like some stats, like in HIV infected infants, the mortality is very high, and if they are not diagnosed early and started on treatment, there are like 75% of the infant actually died because of HIV if they are not being diagnosed and treated. So it's critically important for children to get tested at the earliest and started on ART. So in the context, I think we have discussed in detail who all are the contexts. So I think we should go to the next slide. So where should it be offered? All the confirmatory testing facilities, like it can be ICTC or PPTCT, even some of the mobile ICTC, if they are working as confirmatory testing sites, it can be offered at those sites. And then at the ART center or the OST center where HIV positive clients are visiting, even at the care and support centers, targeted intervention sites if they are working as the confirmatory HIV testing sites, or if they are leading with the because targeted intervention sites are working with the key population, so they can still be, even if they are not having the community having a confirmatory HIV testing facility, they can still be supporting to the ICTC for offering index testing to the key population, those who are visiting a targeted intervention sites. Next slide, please. So who can offer index testing at these different sites? Like a TI and OST center, it can be by the counselor or staff nurse or the outreach worker. It can be actually anyone at these facilities. Point is, those who are engaged in index testing, they need to be trained on index testing services. Without providing training, people should not start offering index testing. So at TI or OST, it can be counselor or staff nurse or outreach worker or the peer educator or the navigators. At ICTC, it is counselor. At ART center, it can be counselor or the staff nurse or the care coordinator. At care and support center, it can be peer counselor or the outreach worker. Anyone who is engaged in index testing, I'm reiterating again, anyone who is engaged in index testing need to be trained on offering index testing first, and then they should be involved in index testing services. Next slide, please. So when it should be offered? So during pretest, it may not be the right time to offer index testing, but during pretest, we should just inform them about index testing, how it works, and what is the benefit of index testing for their partners. We can just introduce the concept of index testing during the pretest. Okay, at ICTC, someone is there and accepted for HIV testing at that time after they have given consent for HIV testing. We can say like, okay, just I wanted to tell you, like, since it's a HIV test and we are equally concerned for your partners as well. Tomorrow, if you turned out positive, there are high chances like your partner or the family member or the biological children are already get exposed and are already infected. So we will like to know about their status as well, so that we can initiate them also on training on treatment, and so that they should also provided with the services, and their viral load can also be like suppressed with the early ART initiation. So once your test results are available, we will discuss more about that, and we will like to reach out to others in your contact as you agreed and as per your convenience. Whatever way you agree, we will discuss more, and we'll try to figure out how we can reach out to your partners. So that way you can just introduce the concept during the pre-test. No need to share much details about the index testing. No need to create fear or apprehension about status disclosure. Make sure they should understand the importance of HIV testing for their partners and spouses. That's it. And remember, it's not a one-time event. People may not get agreed for for sharing their partner details on the first visit itself. Even during the post-test counseling, also someone may feel uncomfortable in sharing details they may need some more time. That's why we are saying like index testing can be offered at any of the site. It may not be necessarily at ICTC only, because at ICTC once person is tested and detected positive, after that ICTC will link the client to the ART center, and it's quite possible that person will not visit at ICTC again and will be coming more regularly at ART center. So if something is missing from the steps of index testing services, the rest of the work can be taken up by the ART center. Apart from that, someone is already registered with ART center but is not having viral load suppressed, or there is a change in relationship status, or the person was like lost to follow up and returned back. So these are the conditions where ART center need to re-offer index testing, even if the index testing was offered before and contacts were contacted and already testing was happened for all the partners. But if there is a client who's having unsuppressed viral load with the change in relationship, or a person was lost to follow up and returned back after treatment eruption, these are the conditions when we should again think of inquiring about the new relationship and just to offer index testing to the HIV testing to the other partners. For biological children, if the status is unknown at the time of ART enrollment, we need to inquire about them, and we need to offer them once. If they are tested and their status is known as negative, and without an ongoing or new HIV exposure, there is no need to retest them. But for the partners, it's definitely we need to retest them if they are at ongoing risk of exposure, risk of HIV. Next, please. So now it's a question. You can just
Sir, we
quickly
have the
answer in the
e-poll.
chat box. Okay, go ahead
Okay.
with that e-poll.
Kiran sir, can we quickly run the e-poll, please? Thank you. Participants are requested to please answer the first question. Only the first question. All the participants are requested to please answer the first question.
Ma'am, all questions in one poll.
One poll. Got it. Participants are requested to please answer the second question as well. Kiran sir, for the third question, we'll take up the answers in the chat box. Sudhir sir, please let us know when to end the e-poll.
There are more than 200 participants, and still I think
Yes.
for first question 40 only responded. So let us wait for a couple of minutes more,
Okay, sir. Okay,
so that
sir.
we should have some reasonable number. Yeah.
Right, sir. All the participants are requested to please take the e-poll.
I think once 100 responses are there, we can stop it.
Okay, sir. Okay,
Otherwise,
sir.
yeah, time is short, so maybe
Right.
one more minute and then we can.
Okay, sir. Requesting all the participants to quickly answer the e-poll. Kiran sir, we can end the e-poll now.
Yeah, I think 100 people have answered, so fair good number.
Yes.
So for the first question, I think still there is some gap in understanding. I will try to reiterate on that. And second, I think is okay. Most of the people are on board, and yeah, and third also is mostly clear. Like okay, okay. So can you go to just click next? So the answer is this third list. It focus on testing individual who have known exposure. So it's not like only testing of children or provider initiated follow-up. It's like, we are offering testing for everyone who has known exposure to HIV. So that is how index testing works. So that is what we discussed in the previous slide when we were like talking about who will be the context of the index case. It can be everyone who is having a known exposure to HIV. Needle sharing partners or the sexual partners or the spouse or the biological children, everyone. Next, please. Okay, the question, it was like very well taken. So at all the facilities, just click next. Yeah, so all the facility where HIV testing is available, it's like confirmatory HIV testing, or the facility where treatments is being provided, ART or the OST center or the TI sites can be a part of index testing. Next, please. So now we will discuss in detail about the 10 steps of index testing. So go to the next slide. So as I said, the first thing is we will introduce a concept of index testing during the pre-test counseling. This will be done by the ICTC. Now I will cover ART center level work also for the index testing from this slide onward. So ICTC counselor will introduce the concept of index testing during the pre-test counseling. Then once the result is out, he or she will provide detail about the index testing services and inform them about the it's a voluntary type of services. You have all the right to like participate or just say no about index testing. And then they will share information about what are the services available, and these services will be provided to you free of cost without any other challenges, even if you do not participate in index testing. And inform them about the confidentiality and take their consent. Once they give the consent, they will start inquiring about their partners and children's. We will discuss one by one for each and every step. Why I'm saying this here is, when a client is at ART center, different client may be in different position of index testing services. Someone might have accepted index testing at ICTC, and already everything related to index testing is being taken care by the ICTC counselor, and the contacts are being contacted, and their HIV testing is in process, or they are already tested and they are in process of like treatment linkage or something. But at the same time, there are chances like the index case was not very comfortable in sharing contact details during the post-test counseling, and he or she wanted some more time. That's why they refused. And the step 1 and 2 was done, but at step 3, the consent was not given. So at ART center, you need to inquire about the index testing, whether index testing was offered at ICTC or not. If it was offered, it was offered, what is the current status? Are they aware of whether their partners were contacted, whether the partner testing is happening, whether they shared their partner details or not, and what are their concerns, why they do not want to share, and how ART counselor can help them for improving the partner testing results. That way, they need to start inquiring, and accordingly, next step can be taken by the ART center. Next slide, please. Next. So in step 1, when ICTC counselor is offering introducing the index testing, he or she will inform about the importance of doing index testing, why it is important for HIV positive part. If their partners are already positive, then they will be linked to the treatment services, and they can be like able to live quality life. If they are negative, then they will be linked to the prevention services, and we will make sure like they remain negative with the different approaches of like preventive services. And for children, you can say like because we have observed that there is high mortality among infants and children, so it will be good if they can be tested and they are positive, then to be linked with the treatment services. Similarly, negative can be linked with the services by whom they can be like stay HIV free. So likewise, this much information can be provided during the step 1. Next slide, please. Then during the post-test counseling, they will provide additional information about the index testing services. They will provide information about the 4 partner notification strategies, how they can bring their partner, how the partners will be contacted for HIV testing, and again reiterating about the consent of the index case and confidentiality and voluntary nature of the participation index testing, and again reiterating about the importance of their partners or children get tested. Next slide, please. So once we have introduced index testing during the post testing, we will reiterate about the confidentiality, and maybe you can use these statements for reinforcing confidentiality, like we are not going to tell your partners about your name or the test results. We are not going to tell them about your test results, or not only your partner, we are not going to share this with anyone else. And similarly, your partner's result will also be not shared with you. Even for the children's also, their results will not be shared with you until and unless they are ready to share. And we are not going to contact your partner or children without your permission. And you or your partners will continue to receive services, whatever it may be, as per their eligibility criteria, and whatever services are available, they will continue to receive those services. And if they have any sort of questions, apprehensions about confidentiality, those can be like dealt carefully at this step only. And after that, you can obtain the verbal consent to continue. Next, please. So this was about the ICTC, and once this is done, they will inform them about the voluntary services nature, and it's like voluntary and without any force or coercion, and they can decline at any point to participate in index testing services. And then next slide. So then comes the part of consent taking. So consent for sharing their partner details. So mostly these 3 steps can be undertaken at ICTC level. But if, as I said before, if client was not confident, not ready to share their partner details, it can be like at first stage only the information was provided. During post-test counseling also some information was provided, but client was not ready or wanted some time, so consent was not given. So you have to start it from scratch at ART center. Similarly, as I said before, like for the people, those who are having loss to follow-up, or those who are returned back after loss to follow-up, or those who are having high viral load or not suppressed viral load, or having some change in relationship data, these people need to be offered index testing at ART center, because these people will never go back to ICTC. Even if their index testing was done before, all the partners were already contacted, we need to again offer index testing to these people during the course of treatment. And once the consent is taken, confidentiality is ensured, voluntary nature was explained. Next slide, please. The next step 4 to 6 can be taken at any of the facility. There may be like some person who agreed for participation, given consent, shared their partner detail, but during the visit at ICTC, but after that client actually did not visit at ICTC. So step 1 to 3 were like undertaken by ICTC, and ICTC counselor may inform them, okay, I have even step 4, like preparing of list was done. Then ICTC counselor can inform this client, okay, thank you very much for sharing this detail of your partners. I would like to reach out these partners for offering HIV testing. But before that, we need to do some sort of intimate partner violence risk assessment, or to identify which method will be like preferable for which partner for offering them HIV testing. And I think today we do not have sufficient time, and I will wish to discuss more on this with you on the subsequent visit. And you can discuss subsequently with the ART counselor as well if you wish for. And we will share this much information, whatever you have shared till date, we will share this much information with the ART counselor. Like that, ICTC can pass this list to the ART center, and subsequent work can be taken care by the ART center. So now coming to the step 4 in detail, go to the next slide. So like this. So once we have the consent for reaching out to the partners, we will try to inquire about the partners detail. So we will start with the latest partner and go back in time until the 12-month period. And we will try to inquire about sex partners, all with whom index client had sex in last 1 year from the recent sexual partner back in time. Try to make a exhaustive list just to make sure everyone those over like having some sort of sexual contact with the index case should be listed in that list, even if the it was a casual partner, or it was with condom or without condom, whatever it may be. Just make sure the list is prepared. And same way for the injecting drug users also. So just to ensure for whosoever like is the with whom the needle or the injecting equipment was shared, their name and contact details should be enlisted. So next slide, please. This activity is known as a partner elicitation. Under index testing, we are in step 4, where we are eliciting the partners. We are doing the partner elicitation. I can understand challenges at counselor level about asking for the sexual contacts other than spouse, because we have seen during field visits like asking for the injecting partner is a bit easy, but for asking for the sexual partner is a little bit difficult, and people do not feel comfortable in asking about that. Usually that is how people used to miss asking for this thing, and they just end up like asking about the spouse and the injecting partners and the biological children. So it should not be the case. We should try to improve on partner elicitation. We can use different terms, some humor or some slang terms, try to understand more from the client's perspective, give them time, build your rapport, ensure voluntary nature of participation, ensure confidentiality. And maybe at this point, you may want to reiterate about the confidentiality and voluntary nature of participation. Use some different terms and make them like feel comfortable in sharing partner details. Next slide, please. There are some different strategies which people have adopted in field for partner elicitation. Like one is like, if someone is not at all agreed for sharing partner details, you can simply come up with, okay, there is a Dropbox in the waiting area. You can just put the name and phone number of your contacts without putting your identity in that paper. Just put the name and contact number, those you wish to be contacted by us for offering HIV testing. So that is one way of doing completely anonymous HIV testing. Or you might have some people like experienced in contact elicitation, and they might be termed as the expert elicitor, and they can be like supporting other counselors in managing difficult cases, or a repeated supportive supervision by SACS or DAPCU by these expert elicitors, mentoring, or maybe through the case conferences like Chalk Talks, so that people will share their experience of how they were able to like reach out to the maximum number of sexual contacts. So or you can simply work with the client on like what type of messages you will use, so that they can be like make aware of like, okay, this is purely anonymous or confidential sort of activity. And just tell them, okay, if you want me to contact your partner, I will prefer to go with this language to your partner. If that is okay with you, or you want some modification in this language, I just want to ensure like you should not feel uncomfortable, or it should not be like I am giving any clue about you to your partner once when I am offering to offering HIV testing to that partner. So that will actually help in improving your rapport and confidentiality in you for the next case. Sometimes you can just emphasize like, yeah, I know like people feel discomfortable in sharing their partner detail, but at the same time it is beneficial for your partners to get them tested and to start on ART in timely. Likewise, you can use some different versions and work with the partner, work with the next case about the language which can be like okay for using. Next, please. So once you are done with that, once partner index case has shared contact details, and you can thank them, and then again, okay, this is the list which we have prepared. Now I would like to contact each one of them, and before going to contact them, I would like to know how you want like us to contact them. There are 4 different ways by which HIV testing can be offered to your partners. One is like client referral, where you take the onus of like bringing them, and whenever you are okay, you can bring them to the facility for HIV testing. There is no need to share your status with them. We can work on the questions and how you will be like bringing your partner. Then other method is like provider referral, where with your permission we will reach out to your partners for offering HIV testing. And third is like dual referral, where if you need, we will accompany you for like requesting your partner to get tested, informing them about importance of HIV testing and bringing them for HIV testing. And fourth is like sort of contract referral. If you want some time, you can take your time, and after that time is over, if you are like feeling confident and convenient in bringing your partner, you can bring after your partner after that particular time. So likewise, you will tell them about the 4 different approaches. And while telling them about the 4 approaches, once the list is prepared, you will try to inquire about, okay, this is the way you agreed, but I just wanted to know whether there is any sort of intimate partner violence attached with this particular client. For that, you can ask some questions which are there in the next slide. If you can go to the next slide and then quickly jump back to this slide. Like these are the recommended questions. Like, has this particular partner, you have the list till this step, you have the list of partners, right? So you can ask with the name of that partner, okay, has XYZ person ever hit, kicked, or slapped, or otherwise physically hurt you in past, or ever threatened to hurt you, or whether this partner ever forced you to do something sexually that made you feel uncomfortable. These are the sort of recommended questions for inquiring about the IPV. If any of the question is having answer in yes, you can think of there is some intimate partner violence attached with this particular partner. Go back to the previous slide. So for each and every partner listed in the list, you have to ask those questions. And if there is no history of IPV with the particular partner, you can offer those 4 different strategies as I was discussing before. So out of those 4, whatever is okay with the client, we can go ahead with that particular strategy. But if partner reports some sort of suspected IPV with the partner, we can again discuss in detail. Okay, I understand your concern, and if that is the case, will that be okay for dual referral? If I accompany you and we together share this thing and make them like try to tell them about importance of HIV testing and bring them for the HIV testing, if that is okay or not. Or if you want us to reach out to them anonymously without revealing your status or without revealing from where we are reaching out to them. So that way, if we can try again. If client agree, then we can go ahead. If client say no, I do not feel so, because I have my own doubt about my partner will be able to make out about me, and there is a potential threat attached with this, so I do not want you to like reach out to my partner. That is also completely fine. We will not reach out to them, and at that point we will decide just to avoid going further in index testing. So the point is, if client is not confident, we are not going to reach out to their partners without their consent or without them on board for reaching out to the partner. Next, please. So this is what we discussed. Like these are the questions, and if you want to ask some more, you can always ask. But the point is, you need to understand whether there is a partner violence attached with the particular partner if we are trying to reach out to that partner. And if there is a risk, then we will not go further. Next, please. So, but if the risk is there and partner index case has reported some sort of intimate partner violence, our work will not stop there. We need to know more about the sort of what type of this violence is. Is it physical or social or emotional sort of threat, which is the concern of the client. So there is something known as first line support, as acronym LIVES. So we will try to understand more with listening closely with empathy without any judgments. Inquire more about their concerns, what type of concerns are. Then show them like you are listening to them and you believe what they are saying. So validate that response. And as I said, whenever a person is offering index testing, they need to be trained. And again, with the training, before initiating index testing, you need to do some homework. Need to understand what type of support is available in your district or in your city. If someone is reporting IPV, if suppose it's a sort of physical harm which they are expecting, so there are chances like people will be beaten up or they thrown out of their home. So they may need some shelter, right? So where they can reach out for in that condition. So that sort of resource directory need to be made available. If there is a night shelter needed, then where we can link them. If there is some sort of emotional support needed, where we can link them. Is there a family member who is like knowing the status of index case and who will be like of support, or is there some NGO or CBO working in this field who can be like of support, or if they need to like contact police or law and enforcement department or some sort of women help group or some sort of somewhere some sort of facilities or some support is available in your district. Make a list of that, keep it handy with you. Whenever a client reports sort of IPV, you need to inquire about that in detail, and if there is something and you have to enhance the safety accordingly, discuss the plan with the index case and try to protect them so that there should not be any harm, and then support them through appropriate referral to the services wherever it will be available in your district. Next slide, please. So basically, it's the role of the index testing provider is to make the list of all the resources available in the city or district, ensure that you understand the concerns of the client, and it's the sensitive information, and discuss with them, explore all the possible options and respect their wishes, and just tell them about what are the services, what are the support available, and how you will be like able to support them, and accordingly from the list appropriate link them to the appropriate services. Next, please. So now we will discuss a more bit about the 4 different strategies. If like client has chosen, next slide, please. Whatever option is chosen by the client for a different partner, it can be different for different partners, right? If for one partner client has chosen like client referral, but other he or she want to choose provider, the contact referral, that is absolutely fine. So we have discussed in brief about these 4 strategies. Client referral is, I just reiterating, like client referral is when client himself or herself take the onus of like bringing the partner to the HIV testing facility. Provider referral is when he or she say like, okay, healthcare provider or the counselor can reach out to the partner and inform them for getting themselves tested. Contract referral, they wanted some time and they end up like, okay, 14 days, it's not a like exact 14 days, it can be 14 days, 1 month, or any time, whatever is like index case is comfortable with. So index client is saying, okay, I will bring my partner maybe after 14 days or 1 month period, give me some time and I will bring them. We can give that time, and after that time is over, we will again reach out to the index case just to ensure whether they are comfortable in bringing the partner or still they need some more time. Accordingly, we can prepare our next one. Dual referral is when index case says like, I want you to accompany me for convincing my partner for getting HIV testing. Next, please. So we have to review all the 4 strategies, and accordingly we start whatever strategy is adopted, we will start reaching out to the partners of the index clients. Next slide, please. Next. So once we have this list of contacts and their preferred mode of contacting their partners, we will start reaching to them. And before starting that, again, we will sit with the index case. Okay, for this X partner, you have chosen client referral. Can you tell me like how you will bring them? What information you will like to share with them? Do you want to share your status or not? If not, then how you will tell them for coming to the HIV testing facility? Can you need some help in framing that language so that your status cannot be revealed to them? I will be in position to help you if you wish for. Like that, you can again reiterate them like you are equally concerned for their status and everything. Next slide, please. So this is a just a recommended language. If you can work with the client, okay, if you are choosing the client referral, this is the language which you can use without revealing your status. Like say, for example, I went to the clinic for a checkup and the other day, and the doctor was encouraging people to get tested. So I got tested and learned that I have HIV. If you want to like disclose your status, if not, then the language can be different. I wanted you to know so that you could also get an HIV testing. There are medicine. I recently came to know like there are medicines available for HIV treatment, and then people can live quality life for a longer period. There is no need of worrying about HIV positivity, and we can just live a longer life, as it's like a chronic manageable disease and as it's like a hypertension or diabetes. So accordingly, you can work with them, brainstorm some questions and reactions of their partner, and accordingly finalize the conversation, whatever client is feeling comfortable with. And accordingly, you can set an appointment. Okay, after 1 month, I will like to follow up with you just to make sure like whether your partner is agreed or not, or whether they are tested or not. And at this time, you can again reiterate, okay, if your partner, if you will bring your partner and they get tested, I may not be in position to share their status with you because they are also equally important for me. So if they do not give consent, I am not going to share their report as well with you. So just wanted to ensure like you should be knowing this thing. So like that, you can again reiterate this thing to them. Next, please. So now if client has chosen again, you can tell them, okay, since you have assigned this thing to me, and I will be like going to contact your partner. I just wanted to tell you like how I will be like reaching out to your partner. So before that, shall I know what may be the right way of to reaching out? Is it like that? Should I call them or just go to your home and start contacting them? So if it is telephonic, then what language I should use on phone? What should I say? And if it is home visit, and I will like to use this standard script which is there with me. If you can see this, and if you are feeling comfortable, then I will use this script only. Accordingly, you can work with the index client on the questions. I can tell you the some sort of script which is there, which is like, go to the next slide. So this is the script for the offering index test or HIV testing to the partner through phone call. This is tried and tested script across the globe, and it's proven very effective in reaching out to the partner and without any harm or adverse event. Like, good afternoon, my name is so and so, I am a counselor at so and so hospital. No need to tell HIV testing facility, I am a counselor at so and so hospital. Am I speaking with XYZ, the name of partner? You can take care. So if it is not there, if they say like, no, it's not from this person, it's someone else, then you can simply say, okay, when he or she will be available. If partner is not available, then okay, I will call you back later. If it is partner, then you can continue with your contact. Okay, I have some information, important information for you. Is it good time to talk, or when would be the better time to talk? Like that, you can continue with your discussion, so that it should not be any like inviting some questions or creating some violence with the index case. So I'm not going in detail of this script. We will share this presentation, and script will be there with you. You can use this, or if you want to modify it, you are free to do that. Only concern is make sure whatever way you are contacting the partners, there should not be any harm attached with that contact to your index case. Next slide, please. Again, a script for SMS. If you are sending some text message to the partner, how that message can be drafted. There are some different sort of scripts for the messaging. Next, please. And this is for the home visit. If you are going to the home of the partner, how you should introduce yourself. And I think it will be good to work with the index case on different type of script, and whatever is index case is feeling confident, accordingly you can plan your visits or the contact. Next, please. So if clients use a contact referral, then it will be like, they will say some period, it may be 14 days or it may be 1 month or more. So whatever period they feel comfortable, we should give that period to them, and after that we can again contact them to remind, okay, your period is over, and now I will like to know whether you are ready or if still you need some time. Accordingly, we can reach out, and again after that period is over, we need to like reiterate again about the importance of getting their partners tested, and how that will be like beneficial for them to get linked to the treatment or the prevention services accordingly. And again, you can offer them different mode of like reaching out. It can be client referral or provider referral or the dual referral, whatever way they are confident in. Next, please. So if it is dual referral, again, during dual referral, it is not like you are going to share the status of the index case. It's not like that. You will be just accompanying the index case, because he or she wish you to be there while sharing with partner. So it's their call whether they want to share their status or not. If they want to keep it secret and just they want to convince them for HIV testing, that is also fair enough. Again, you have to work on the questions and answers before going to the partners, before going to contact the partner, even if it is dual referral, just to make sure that both are on same page. Okay, we are going there, and we will how you want to like start the discussion, and how will you tell them for the HIV testing? Do you want to reveal your status or not? If not, then how we will start our discussion, and if this type of question will come, what should be the answer? like that, you should work with them and accordingly plan your visit. Next, please. Point is, you may not be like breaking the confidentiality. That is important thing. So beware, like when we are using technology for offering index testing or HIV testing, if like your index case is telling like my partner is in some other district or some other city, but this is the social profile which belongs to him, and you can reach out to him or her through the social profile, that is also fine. But before doing that, confirm the exact spelling of that social profile, because there are social profiles are different. Like example is given, man 4 as the number, and then you, and then simply for man for you in alphabets. So it's different. So both the IDs might be different. So there is one question: when will the training be conducted for indexation? That this is, I think, training going on for you guys. If you need more time with no more training, you can ask your SACs to arrange for the same. But I think this is the training which we are conducting for you guys. And if you have some queries or some apprehensions, you can reach out to us anytime. There is no issue. And I will share my email ID also, and you can send your queries through email. We will try to respond on that. And just to share, recently we have concluded 2 batches of master trainers training for across the country for all the states. So people, master trainers are there. So SACS will SACS will arrange those trainings for the ICTC and ART counselors gradually, if not yet done. Next slide, please. So once you contact your the partners of the index cases, then after contacting them, you are convincing them for HIV testing, and if they get agreed for HIV testing, then you have to document their result. Is it HIV testing, HIV positive or no negative? Whether they first thing is whether they agreed for HIV testing. If agreed, whether they reached at the testing site. If yes, then whether they tested. If tested, then what is the testing result? Is it negative or positive? And accordingly, you have to link them to the appropriate services. And just to remind, if the partner is HIV positive, we we have to link them to the AIT center, and we have to enroll them as index case as well. Next, please. So for HIV positive, we need to link them with the ART and adherence counseling or risk reduction counseling, about inform about the condom, RTA, STI, TB, OST services, family planning services, counseling on U is equal to U, provide information about U is equal to U, what is the importance of getting them linked to the ART services, started on ART early, so that their viral load get undetectable. And with the undetectable level of viral load, they will not be actually transmitting infection to the people, those who are having sex with. So it's absolutely no risk of sexual transmission if someone is having undetectable viral load. So that information can be provided upfront to the HIV positive context. If someone is HIV negative, then link them with the preventive services. It can be condom or the harm reduction services or the family planning services, OST centers, or maybe with the PrEP if it is available in your area. Next, please. So once you have linked them, make sure you reach out to your index case again, just to understand whether there was some adverse event happened or not after you reach out to the partner of the index case. If there was something, then you need to record that and go to the next slide. So if some adverse event happened, then we need to inquire about that. What type of adverse event was that? Next, please. And what happened, and accordingly, was it like physical, sexual, or economic threat, or was it happened, or this was a threat? Just what it was just a threat, or whether treatment was withheld or forced to do something which is like not comfortable, or abandonment of something, or removal from home, or some removal from school, or can be different. Or simply if the provider was like provider reach out to the partner and did not actually obtain consent for participation or testing, so that can also be a adverse event. So once there is some adverse event, we need to understand what type of adverse event it is. And accordingly, as I said before, you should have a resource directory for each and everything available in your supportive services available in your district or the city. And according to the adverse event, you need to refer or link these people to the concerned services. Next, please. So as I said, like facilitate just after understanding the adverse event, report that or document that adverse event and follow up with the appropriate services wherever you can, like if they need some psychosocial support or the medical support or the legal support, or just they need some emotional support, or just they need to call at the helpline number, or maybe they need some sort of shelter or some financial support or something like that. So whosoever is working in that field, some NGO or CBO or some law and enforcement department people, so accordingly you can link them with the appropriate services. Next slide, please. So now next slide. There are 8 principles of offering index testing. So like these are the 8 different principles. Like index testing should be client centered and focused. It should be confidential, focused, non-corrosive. It should be free, non-judgmental, culturally, linguistically appropriate, accessible and available to all. These are, if I go in detail of each and everything of this, it will take another 1 hour or so for explaining everything. But the point is, it should, these all 8 principles need to be like followed. The service should be free, accessible, comprehensive. It should be non-judgmental, and make sure the confidentiality is ensured, and appropriate language is used to make people confident and willing to share details. Next, please. So these are the 5 C's, as you answered correctly in the poll question. Taking consent. First, when person reach at the ICTC, we take a consent for HIV testing, and then once they are HIV positive, we take again we will take a consent for making the list of their partners and reaching out to their partners for offering HIV testing. So this is we are talking about the second consent here in index testing. Then ensuring again and again about the confidentiality. We are going to maintain their confidence. There is no breach of confidentiality at any point. Appropriate counseling, whatever is the need of the person, accordingly appropriate counseling need to be provided. Whatever is the result, correct test result need to be shared, and then appropriate linkages to the right services. Next slide, please. Next slide, please. So these are the minimum standards. As we discussed, whosoever is providing index testing, make sure 5C, that consent, confidentiality, counseling, correct test result, and connection to the prevention and treatment services need to be adhered. IPV risk assessment should be done, and if someone report as intimate partner violence, a first line response to be provided. After everything is done, just reach out again to ensure whether there is some adverse event happened or not. If there was some adverse event, then accordingly the appropriate services need to be provided. And on top of all these, make sure the person who is offering index testing, they should be trained and regularly supervised for ensuring 5 C's, IPV, adverse event monitoring, ethics, everything. Since we are repeatedly saying it's a confidential thing, make sure the records which are being maintained at the facility should be stored in an appropriate manner and secure environment, so that there should not be any breach of confidentiality of the clients. Next, please. So I think this question was there in poll. Go to the next. Yeah, so it was, yeah. Go to the next. So go to the next. So yeah, so as we discussed previously, if someone is HIV positive, some partner is HIV positive, we will link them to the treatment services. At the same time, we will ensure index testing is again offered to this partner, even if the index case was already offered and we got this client detail through the index case. We need to inquire about the other partners of this new HIV positive client. and make sure the status is not revealed to the index case until and unless the consent was given. And if it is negative, then make sure they remain negative and link them with the preventive services. Next. As I said before, community involvement is very important in HIV services. As we know, like sometimes community will be of support in terms of doing IPV redressal or providing some services to the clients. So sometimes client feel more comfortable in the presence of HIV positive people from community. But we need to provide information about the community DLN or the care and support center or other sort of services provided by the community in your area. And if client is willing, they can avail those services from those community groups. And community network can be involved accordingly if client is willing to be contacted by the community network. Next, please. So key take-home messages. Go to the next. So index testing is a proven strategy of improving case finding. It's effective in improving your first and second 95 goals. It should be expanded beyond key population. It should be expanded to the general population and the biological children. But before expanding, make sure all the minimum standards 5C and everything is like followed up and the person is trained in offering index testing. Next, please. It should be client centered and according to the need and safety of the client. If client do not agree to participate, it should not be like any services should not be like withheld. Everything whatever client is like eligible for, all the services should remain available to the client in any case. It can be provided by anyone at the testing or the treatment facilities, provided they are trained in providing index testing services. Next, please. So as we discussed repeatedly in the during the session, it should be offered to all the sexual and needle sharing contacts, PLHF returning after LFU, those who are unsuppressed viral load or biological children, or there is a change in relationship status. Linkage is most important thing. Whenever someone is HIV positive, immediately that person need to be linked to the ART center for further services. And if it is negative, then also need to be linked to the preventive services. Documentation of all the work which you have done related to index testing or the linkages, adhering to the minimum program requirement and community engagement as it is like necessary. Next slide, please. I think this is my last slide. So remember, there are 10 steps, 8 principles, and 4 different strategies of reaching out to the partners. Next, please. Yeah, I think this is last slide. Thank you very much, and I will be happy to take questions if there are any.
Thank you so much, sir, for facilitating this important session. I'll just check the chat box for questions. There's one, if partner is not told for status, then what about partner management?
Partner
Sachin,
is
sir.
not told for status. Can you elaborate more on that question? Who has asked this?
Dr.
Sachin.
Sachin, sir. Kiran, sir, please give mic access to everyone.
Yeah, Dr. Sachin, if you can elaborate more on that point.
Sir, we have been told that status is not to be told to the partner management as per index counseling.
Yeah, status of partner HIV testing not to be told to the index case, right? That is the question.
Yes, sir. Then in partner management, we have to tell it to the partner.
No, not necessarily. No need to tell partner. What do you mean by partner management? I did not get that point.
If there is a husband and wife combination and husband is positive or wife is positive and other partner comes out to be positive in this situation.
Husband is positive, wife is positive, and another partner comes out positive,
and one of them is negative.
Okay, so the zero discordant couple, right?
Zero discordant. Then we have to go for partner management and tell them to tell it to your partner. And here we are saying that we don't have to tell the status.
So what exactly you have to do in partner management? That is what I am trying to understand.
Sir, we have to tell the partner for the status that so and so is the reason for getting you tested.
So that's what I'm saying. So without revealing identity of the index case, you can still offer HIV testing to the partner.
So we can
And
also,
you can,
but we have been told till date that we have to tell the partner also. So it's a bit confusing for us.
so that's what I'm saying. It's nothing new. It's in law in line with the HIV/AIDS Prevention and Control Act, which was like released a couple of years back. You know, in the HIV/AIDS and HIV/AIDS Prevention and Control Act, it is clearly mentioned. There is no force for counselor or the provider to share status of the HIV positive client to the partner.
Right, sir.
And if you are going to, if you are sharing the status, as you are saying that regarding partner management, before that you need to take consent from the index
Yes,
case.
sir. That
And
was
if consent is provided, then only you are reaching
then we
out.
have a consent that yes, it can be told to my partner.
Yeah, if
Then
consent
also
is
we
not
need
there,
to hide the status.
yeah, if consent is there, then you can share. That's definitely. If consent is not there, there is no need. And then there is one term in the HIV/AIDS Prevention and Control Act. If you can read it carefully,
Sure.
if consent is not there, and the client is sharing some sort of fear about some violence, then there is no need to share the status, right?
Then we don't do it because the
So that's
partner.
what. So yeah. So what I'm trying to say is, you know, if consent is not there, means there is some
Right, sir.
issue. So if that issue is there is no need to
Then
share.
Then we don't tell the
Yeah.
partner. Otherwise,
But
if they
yeah,
we have to tell it.
yeah. So point here is, you know, we have to ensure it's not like we want to connect the dots of index case and partner. There is no need to connect the dots. Our priority is to get people tested. Those who are at risk of
Right,
getting HIV, those who are exposed to HIV, they need to be tested.
Yes,
Our
sir.
first concern is that.
Yes,
We
sir.
are least concerned about connecting dots,
So
linking
we are here
people. That's why I
concerned
was
with
giving an
covering
example of Dropbox,
लेट हो जाता है ना
right? There is some disturbance. I did not get. Sachin, are you convinced with the answer, or still you
Yes,
want
sir.
to?
Yes, sir.
Okay, okay, thank you. So, is there any other question? Like there was some discussion happening, so I don't know whether there was a question or it was just the internal discussion. Spouse right after 14 spouse rights after 14 days. What does that mean? Hemant Kapoor, if you can elaborate on that.
Hello,
Yeah,
am I audible?
I can.
Yes,
Yeah, I can hear
am I
you. Please.
audible?
Yes,
I was
please
just
go
I
ahead.
wanted
writing
to
that.
know if you are not able to disclose the status of the partner.
Hello,
Hello.
Yes,
this is me,
please
Dr.
go ahead.
Hemant.
Please go ahead.
Hemant calling, but
So
I
that
think
defeats the prevention part of.
another participant has also started talking. Can I? Hello.
Yeah,
So please go ahead.
Please.
This is Hemant I'm talking. I was just writing that you tell that about client when client is asked that he'll be preferring to bring the partner for testing, and after 14 years, within 14 days, if he doesn't bring, then we can again reach out to the client, the index case, and tell that you have not brought. So I am forced to reveal the status to the client. You just
Uh,
initiated. You told.
no,
So
no. I'm sorry, Emanji. What I was trying to say is there will not be any forceful disclosure. It's not the 14 days. I was repeatedly saying it's not just the 14 days. It's like anytime. So it's contract referral is something like when you are giving 14 days, you reach out to the person after 14 days just to inquire about whether person is confident or not, or if they still need some more time. You will wait for unlimited time till the client is confident enough to bring the partner, or at every time you will offer different approaches. You can always discuss 4 different strategies. If client is not confident in bringing the partner, can provider reach out to them anonymously? Can the dual referral will be the better option? You can ask about the intimate partner violence, why they are not bringing. Is there some sort of partner violence they are expecting, and how we can reach out to them? If they say, yeah, I am expecting a partner violence, I do not want to be in trouble, so that's why I'm just avoiding this thing. So if that is the case, we are not going to go ahead with this thing, and we will stop inquiring about that partner. If they tomorrow, if they turn out
That's
okay,
fine.
I just want to go to the provider referral, then you can go ahead with the provider referral. There is a suggestion from Vinod Kumar. I think there should be a local training as well through SEX. Yes, definitely. As I said before, we have trained master trainers of all the states. So there will be a training definitely. So there is one more question which is sent directly to me. Sir, list made of the index testing HIV positive person, and he asked about do not share my status with anyone from list. If we call them, they can ask for where from you get my number. Yeah, very right question. I will say thank you, Lakvir Singh, for raising this question. So that is why we have given some scripts. You know, there were scripts in the presentation. So you can work on that script with the index client. Okay, I am, as you have given consent, I am reaching out to their partner without revealing your status. I will like to discuss with him or her in this language. This is the questions and answer which I am like planning to share with your partner. Is that okay? Or so do you still think like they will be like able to make it out like you have referred, or what? Or if you can tell me like how I can reach out to them. It can be like simply saying like I'm a healthcare worker from so and so hospital, and in our hospital we are motivating everyone to get HIV testing done. And we, through our data analysis recently, we realized like in this particular area or in this particular village, HIV is increasing. We are here to tell everyone to get themselves tested. So will you like to get yourself tested? That is the way you can reach out to them without revealing status. If that answers your question, Lakvir Singh. Yeah, Jaipal saying something. This approach will defeat prevention strategies of HIV and legal implication to us. So that's why, just to avoid legal implication, that's why we are saying without consent, without taking consent, without uh, index case in confidence, you are not going to reveal status. You are not going to reach out to the partners if there is some intimate partner
Sir, please
violence
listen
attached.
to me. Am I audible?
Yes, yes,
Am I audible?
yes, yes. You are very much audible.
Legal
Please go ahead.
implications may come. The partner would have say, you didn't disclose the status of my partner to me.
Okay. If
And I
if you are not,
want to take divorce from the partner. You didn't disclose it
yeah,
and now become HIV positive because of your fault.
no. See, listen. It is very much in the HIV/AIDS Prevention and Control Act. If there is some harm attached to this, we are not going to disclose the status, right? And we are telling them we may not be in position to share your partner status with you until unless there is a consent. If partner provide consent, then only we will be sharing that status with you. So that we need to tell them clearly. You know, the most of the time issues arises when we are not able to explain them about the importance of getting HIV testing done for them and for their partners. If we are clear in our counseling and our message, then I think there may not be any harm. And we in no way we are going to reach out to the provider or the to the context of the any of the index case without their consent, or without anything. We are just not going to share their status with them.
The partner may say you didn't disclose the status, that's why you become HIV positive.
Yeah, but you have all the right in the HIV/AIDS and Prevention and Control Act. If there is a threat, if there is a threat of divorce and everything, you are not going to disclose status. That thing you can discuss with them.
Act is gone against prevention, sir. That was saying act has gone against
It's
prevention.
not going against prevention. It's not going against prevention strategy. Prevention is not disclosing the status. Prevention is providing them information about the preventive services and linking them to the preventive services. It's
The
not just the
status may use
disclosure.
control,
Sir,
condone.
excuse me, sir, we are short of time, or this can be taken up with SAC separately, please.
Yeah, maybe. Yeah. So, Jayapalji, you can write to your SACs, and maybe if you need some more information, we can discuss more. But the point what I was trying to make is prevention is not just the disclosure. Prevention is identifying right person and linking them to the appropriate services. That is the prevention. Thank you.
Any more questions? Dr. Shravani, you have unmuted your mic. Any question?
No, ma'am. No.
Okay, thank you. So I don't think there are any more questions.
Okay.
Thank you so much for facilitating this session. Thank you to all the participants for patient listening. We can conclude the session now, sir.
Yeah. Thank you.
Thank you, sir. Thank you, sir.
Thank you very much. Thank you all for participation.